Here are three signs that you might have bipolar disorder. This is the mental health condition that has the highest suicide risk, but somehow we tend to miss this diagnosis, and people sometimes have to wait 10 to 15 years for an accurate diagnosis of bipolar disorder, when I believe everybody who shows up with depression in the office should be screened for this. So let's talk about it. Three signs that you might have bipolar disorder. Number one, you get these sudden surges of confidence that come out of nowhere. You may have been a little depressed before, or you may have been feeling kind of bad about yourself, but out of nowhere you get this sudden surge of confidence, and now you feel like you can do anything. You feel like you can do anything, you start to feel really good about yourself, you start to actually get things done. The confidence comes with productivity. So not only are you confident, but we're productive. We're cleaning the house, we're catching up on things that we should have done last month, we're cleaning the yard, we're cleaning the garage, we're doing all these deep cleans, and the house is starting to get cleaner, your environment's starting to get nicer, you may work out more often than you normally do. So now you're getting in shape, you're getting finer, you feel amazing about yourself. The dangerous thing about this is that mania often comes with this belief that you don't need a lot of sleep. So you start to cut back on the sleep. And anytime you cut back on sleep, and this is for anybody, bipolar disorder or not, we run the risk of psychosis. And we often see that with bipolar disorder. So you feel so good about yourself, you cut back on sleep, you start to engage in these risky activities that can be substance use, it can be risky sexual behaviors, it can be behaviors that have a lot of thrill behind it, gambling, driving your car super fast. And after this huge wave of confidence, and we call this mania, but after this manic period, it's normally followed by a depressive crash. And this is when you start to not really like yourself, and this is when you start to miss that mania, regardless of how dangerous that mania was. Number two, there's this restlessness that occurs in the nighttime hours, maybe around 6, 7, 8, that you feel that is very unnerving. It's uncomfortable, and when you feel this restlessness, small things start to piss you off. You're easily distractible, and this restlessness sometimes leads into that insomnia, which sometimes is a catalyst for mania occurring. So this restlessness that you see at night, and I don't know why it happens at night. I'm still looking into that, but there's this restlessness that happens around the nighttime hours, and you just feel uneasy. You feel a bit more anxious than normal, and it leads to that insomnia that causes the mania. And sometimes that's the first sign that you're becoming manic. Is this restlessness at night, and it stifles your appetite sometimes. I see a lot of people who are about to enter a manic episode just lose their appetite. And sometimes they'll go days without eating because they just don't have that appetite. But you're up at night and you're just a little restless. And shortly after the restlessness, you find yourself in this manic tailspin where you're having a lot of fun, but like I mentioned earlier, it can be dangerous. And the third sign of likely bipolar disorder is somebody who takes an antidepressant and it pushes them into a manic episode. A lot of times when you have bipolar disorder, you're presented to the clinic in a depressed state. So the provider probably didn't do a good job of screening. And sometimes as providers, we kind of suck. All of us can do a better job, myself included. But you present to the provider's office and it appears as if you're depressed. With that information, the provider goes ahead and prescribes you antidepressant, a Zoloft, a Lexapro, a Prozac, one of these medications. And then instead of you getting back to an even mood, you get all the way up to the top where you become manic. This is why we have to make a clear distinction between depression and bipolar depression. If you have bipolar disorder, you shouldn't be on an antidepressant with no mood stabilizer. And if this is what your doctors put you on, forget what I'm saying. Just throw this out the window. I'm just telling you what I do. But I never leave a patient with bipolar disorder on just an antidepressant. They can have an antidepressant, but I normally add a mood stabilizer just to protect against the mania, because we already spoke about how dangerous the mania can be. So these are three signs of likely bipolar disorder. Hopefully this helps you out. And if you know somebody who has bipolar disorder who could benefit from this video, because it helps them learn about themselves more, or if you're dating somebody who has bipolar, or if you have a parent or loved one with the condition, just know that this condition is one where you can do really well. A lot of people who have bipolar disorder don't have any type of interruption to the quality of their life. They're living their life, they're chasing their dreams, they're doing their thing. I think the most difficult thing with bipolar disorder is really just catching it in time.